Now we'll be talking about the various antihypertensive, that is the blood pressure medicines for in pregnancy. Now we must treat any high blood pressure, the systolic blood pressure which is more than 140 persistently, or if the diastolic blood pressure is persistently more than 90. If it is persistent on 2 to 3 to 4 occasions, then it has to be treated, otherwise it can complicate pregnancy in various ways like eclampsia, fetal retardation, placental insufficiency, and increased risk of intervention. One of the most earliest drug that is used for hypertension in pregnancy is labetalol. Now, labetalol is the most widely used drug. It is alpha plus beta blocker. It comes in oral form, and most of the time it is started with 50 milligram 3 times a day. It can be increased to 100 milligram 3 times a day, and up to 1200 milligrams can also be used. But most of the time, this much dosage is usually not indicated or it is not required. Most of the time, 300 to 400 milligram is more than sufficient. Or if it is not, it doesn't give blood pressure control, then additional calcium channel blocker is added. Now, nifedipine is one of the most commonly used second drug, or it can be first drug also for hypertension in pregnancy. This nifedipine in sustained release form is very commonly used. Nicardia SR20 is very commonly used for hypertension in pregnancy. It is a calcium channel blocker, so automatically it causes vasodilation and it causes fall in systolic as well as diastolic blood pressure. It's very commonly used, and the Nicardia's sustained release 20 milligram, it can be used once, twice, or up to thrice a day also. As it causes vasodilation, it can cause reflex tachycardia, but it is very well tolerated and very commonly used with labetalol. The third drug that can be very commonly used is methyldopa. Now, methyldopa has the most extensively used drug, especially in pregnancy. The dosage can be 250 milligram to up to 1000 milligram per day. Mostly 250 milligram twice, thrice, or 4 times a day can be used in pregnancy. Most of the time, 2 to 3 times a day is used, and maximum up to 3 gram can be used. But most of the time, this much of high dosage is not required because the patients will always be put on labetalol plus nicardipine plus then methyldopa if it is indicated. If the blood pressure doesn't get controlled well in these medicines, then clonidine can be added. Now, clonidine has a central alpha blocking property, and up to zero point 0.1 to zero point 0.6 milligram can be used. But most of the time, zero point 0.1, zero point 0.2, zero point 0.3 milligram can be more than sufficient. It can be used 12 hourly. Most of the time, the blood pressure is very easily controlled with these medicines. But if it's still the blood pressure doesn't get controlled, then we can add hydrochlorothiazide in lower dose. Most of the time, 12.5 to 25 milligram per day is indicated. Most of the time, 12.5 milligram is more than sufficient. And this is especially used if the patient is known hypertensive even before pregnancy. Then this hydrochlorothiazide can be a very good maintenance therapy. Prazosin, it can cause postural hypotension, so it should be always considered as a second line agent if other drugs fail or if other drugs doesn't give good blood pressure control. The drug which has to be absolutely avoided in pregnancy, these are AC inhibitor, that is angiotensin converting enzyme inhibitor, which can cause fetal damage or growth retardation. So no captopril, no ramipril, or no enalapril should be used in pregnancy. Angiotensin receptor blockers, which are very good drugs for hypertension in elderly patients, but not in pregnancy. In pregnancy, they can cause growth retardation, fetal damage, so they should not be used at all in pregnancy. So no to telmisartan, no to olmesartan, or no to anisartan. Beta blockers like atenolol should not be used at all because they are shown to have some harmful effect in fetus, and no spironolactone as well. So the drugs which can be very commonly used are labetalol, nifedipine, methyldopa, and if it is not controlled, then clonidine, hydrochlorothiazide, and prazosin can be used. Thank you.